Good afternoon, everyone. Welcome. We're going to get started in just a second here. Thank you all so much for joining us. Give us just a moment. Let's let folks trickle in here so we can officially get started. One moment. All right. Folks, a couple more seconds. All right. Good afternoon, everyone. Thank you all so much for joining us today. We're excited to have you. We're excited for this workshop and this robust conversation that we're going to have today. My name is Joshua Harris, and my pronouns are he, him. And I'm joining you today from Baltimore, Maryland, the original land of the Susquehannock people. And I always encourage you to learn more about the original stewards of the land where you are. And so welcome to today's NCIT overview on child tax credits 101. 101, an introduction to the current policy landscape. Voices for Healthy Kids is an initiative of the American Heart Association and works to advance equitable policies that make the places where babies, toddlers, kids, and their families live, learn, and play healthier. And we're also proud to now be staffing the National Collaborative for Infants and Toddlers, or the NCIT, which of course is an advocacy collaborative dedicated to supporting the policies and needs policies needed so that all pregnant people, babies, and toddlers have what they need to thrive. And you can visit us at ncit.org to find out more. I'm the senior manager of communications, marketing communications, and I'm going to help to kind of guide this conversation for us today. And As we move along, I just wanted to quickly kind of do a recap for you all on kind of what some of our policy priorities are for the NCIT. I'm sure many of you know, but we prioritize, of course, healthy beginnings. The health of a baby is shaped from before birth. And so access to care is essential to a healthy pregnancy and healthy babies. So policies that support healthy pregnancies and healthy births include, of course, extending postpartum medical coverage, protecting and expanding Medicaid, increasing enrollment and healthcare coverage, funding to support access to care. There are also policy approaches that we can take that can help to improve outcomes in your communities and help provide stability and support. So, such as Supplemental Nutrition Access Program or SNAP. We also work to we want to reduce the administrative burden on SNAP and increase SNAP access. Poverty is associated with poor health outcomes for both infants and families. And so we work on prioritizing strategies to increase economic security that can improve perinatal health. And so state minimum wage, state earned income tax credit. We're going to talk about child tax credits and so much more here today. Early care and education standards and appropriations as well. So those are just a few things, just as a reminder of the work that the NCIT does here. We also would like to take a moment to invite you to become a member of the NCIT. We've developed an official membership process. For some of you may already be members. Some of you may be like, what do you mean? What are you talking about? I think I'm a member. So we have individual and organizational memberships that we offer. And so we want to make sure that your organization is listed as an official organizational partner and member. So you can visit ncit.org/membership to confirm if your organization's logo is listed as a member. And maybe someone from your organization has not signed on officially. So you may not be listed just yet. So we want to encourage you to take a look, see if your organization is on, as well as for you to become a member as an individual. And so in today's conversation, we'll go through the agenda. We're going to go over child tax credits and how they work. Where are we now, the current landscape of legislation and the current bill in Congress. And then we're going to take a look at the state landscape as well as the importance of child tax credits for child development. And then we're going to circle back around. We're going to talk about action steps, what you all can do to get involved and to engage right now, locally, where you're at, so that you can push and be the great advocates that we know that you can be. And I'm excited today to be joined in this conversation with our amazing group of panelists. who are actually the experts, and I'm just gonna help guide us through this. And so our presenters today are Catherine Menifee, who is the counsel for income security at the National Women's Law Center. Her current portfolio includes progressive tax policy issues with an emphasis on refundable tax credit advocacy and outreach. As part of this work, she investigates how tax policy can promote racial and gender equity and create a more equitable tax code. He holds a JD from Georgetown Law and a BA from the University of Texas at Austin. And we'll also be joined today by Alyssa Schmier, who is the Vice President of Government Relations and National Budget for Moms Rising. Her career has been focused on legislative and policy work in the field of poverty policy. She's previously served as Deputy Policy Director for the Jewish Council of Public Affairs and as the legislative representative for an association of community organizations for Reform Now. Alyssa has also worked in Senator Edward Kennedy's office, as well as Representative John Tierney's office. And she received her bachelor's degree from Hobart and William Smith Colleges and her master's degree in government at Johns Hopkins University, originally from Swampscott, Massachusetts. Alyssa now resides in Huntington Woods, Michigan. And last but not least, Patricia Cole is the Senior Director of Federal Policy with 0 to 3 Policy Center. She leads 0 to 3's work in federal policy formulation, legislative strategies, and government relations in a range of areas affecting infants and toddlers, and also oversees the annual State of Babies yearbook. Patty has over 30 years of experience in policy at the federal and state levels, including serving as a staff to Senator Chris Dodd, chairman of the Senate Subcommittee on Children and Families, with oversight of Head Start, child care, and child abuse prevention and treatment. She holds a BA in history and political science, as well as an MA in history from Duke University. We're excited to dive into this. And so with that, I will pass it off to our first presenter, Pat, who's going to take us from here. And I'll give you the ability to share screen here.
Thank you so much. So excited to be a part of this panel. I am going to give an overview of how tax credits work. And apologies, I'm having some share screen problems. It was working a second ago. Give me just a moment if you don't mind. Let me try one more time and then I'll just wing it with that. Oh, here we go. All right, hopefully y'all can see this. Let me make it full screen. Great. It would have been hard to do the tax stuff without visuals, I'm gonna be honest, so I'm really glad that worked. So what I'm gonna be talking about today is the tax basics behind the child tax credit. For those of us who don't know that much about taxes, which is most people, I think. So first off, the child tax credit is in fact a tax credit. So I'm going to give you a quick overview of what tax credits are and how they work. Tax credits directly reduce the amount of federal taxes you owe. So let's say you do your taxes this year for tax season and you have a $100 bill in federal taxes. If you receive a $100 tax credit, that's going to reduce your tax bill dollar by dollar until you don't have a tax bill. That's how a tax credit works. But a refundable tax credit, and the CTC is partially refundable, gives you the full amount of the credit, even if it's more than what you owe. So let me talk about how that works. If you owe $100 in taxes and you receive a $150 tax credit, you will have your tax bill zeroed out to zero, right? But then you'll also receive that excess $50 as a refund at the end of tax season. This is really important for people with low incomes because they're more likely to have small or no tax bills. So if a tax credit's not refundable, then they're not going to get the full value of the credit because they won't be able to get a refund. But if it is refundable, they can receive a bigger refund at the end of tax season. They can be very beneficial. And I'll talk a little bit about the benefits of refunds in a second. But the child tax credit, it's a partially refundable tax credit. It helps families with children under the age of 17. And currently the CTC is worth up to $2,000 for each eligible child, and it's refundable up to $1,600. I'll explain more what that means in a second. The CTC was expanded in 2021 and helped cut child poverty nearly in half. So I want to talk about the benefits of the CTC. It helps families make ends meet and lifts many families out of poverty. And part of that is because it's partially refundable. For families living paycheck to paycheck, the CTC and other refundable tax credits are especially important because it gives them those tax refunds that can help them pay tax bills and pay bills and reduce debt, meet large expenses because they get that big lump sum at the end of the year, and put aside money for a rainy day. The child tax credit also promotes gender and racial equity because families of color and women-headed households are more likely to have low incomes. They especially benefit from refundable tax credits like the CTC, and the CTC lifts millions of families out of poverty every year. Now, what I want to talk about now is the fact that the CTC in its current form, under current law, leaves many families behind. And that's because of several structural components in the way the CTC is designed. Now, I'm going to run through these structural components real quick, and you're not going to understand them, but just know I'm going to give examples that are going to make them a little bit easier to understand after this. It's just important to lay the groundwork first. So first, in order to receive the CTC at all, families must receive an earned income of at least $2,500. That means that families that don't have incomes, that might include families who have very young children and have to take off work, grandparents who are retired and caring for their children, or parents that have disabilities or other medical crises, aren't able to benefit from this credit if they don't have earned income. Second off, even if you do have income above that earned income requirement, the credit still only phases in at a rate of 15% for each dollar above that requirement. Again, I'll talk a little bit more about what that means in a second. But that means that generally families making less than $13,000 a year will not receive the full refundable part of the CTC. Third, even if you have enough money to have gotten the full credit under the phase-in rate, the credit is still only partially refundable up to $1,600. That means that many families with low or no tax bills will not receive the full value of the credit. Now, those are all structural components that limit the use of the CTC among families with low incomes. There's another exclusion that also impacts families with low incomes. That's that children with ITINs, that is a tax number that you can get if you are not eligible for Social Security number. Children with ITINs are not able to be claimed for the credit. This impacts many immigrant families. So let's give some examples to actually see how these limitations work for real families. I'm also going to give a disclaimer. These photos came first. My estimation of the ages of the children in the photos came second. I do not have children. I might be wildly wrong. So a retired grandmother's guardian for her 3-year-old approximate twin grandsons. Because of the earned income requirement, this family receives no credit. Because the grandmother was retired, she does not have income, she's not eligible for this credit at all. This falls short of the full $4,000 credit that is available to two children families. So many high-income families will receive that full $4,000 while this family receives nothing. Another example of a family that is above that $2,500 income threshold, but still has limitations on their credit. This is a single mother raising her 6-year-old daughter. She makes $10,000 a year working as a home healthcare aide, but because of the 15% phase-in, her family only receives a credit of $1,125. Now, how does that work? So first off, we take how much she makes, that's $10,000, and we have to subtract that earned income requirement because it only starts phasing in after you make that amount. So 10,000 minus 2,500 gives us 7,500. And then so for that 7,500, 15% of that is how much credit she gets because it phases in at 15%. So 15% of that is 1,125. That is significantly less than the full credit of $2,000 for one-child families that, again, many high-income families will be able to get. Now, I also want to give a similar example for a family that has multiple children, because this phase-in rate actually hurts families with multiple children even more. So we're going to say something very similar, a single mother also making $10,000 as a home health care aide, but this time she has two children, a 5-year-old daughter and a 4-year-old son. Because of the 15% phase-in, she's going to receive a credit that's the exact same as the last family, $1,125, because you use the same income, you subtract the income requirement, and you get 15% phase-in. The difference here is that this family has two children, right? And twice the amount of costs of raising children, which is what the CTC is supposed to help families with. But because of the phase-in rate, she only gets $562 per child. This falls short of the full $2,000 per child credit that is available to many high-income families. All right, but let's say we make enough to get above the earned income requirement. We make enough that we're fully phased in with that 15% phasing rate. Surely now all families should be able to get the full credit. Unfortunately, there's one other limitation that limits how much families can benefit from the credit. So we have a single mother raising an infant son making $20,000 as a food service provider. Because of her low income, she owes very little in taxes. Then because of the refundability cap, which means that you can only get $1,600 back as a refund, that's the only amount of the credit that she gets. Again, she doesn't have anything in taxes to be able to be reduced with the tax credit, so she's only going to get that $1,600 back as a refund. She only gets that value from the credit. This falls short of the full $2,000 credit that many high-income families can benefit from because they have higher tax bills. So because of all these limitations, 19 million children are in families who receive less than the full credit. And because of the I-10 exclusion that I talked about earlier, 1 million children in immigrant families are ineligible for the CTC. Now, the next question is, of course, how do we fix this? And we do know how to fix this. We fixed this before. Under the American Rescue Plan Act in 2021, the CTC was made fully refundable. Now, full refundability means that it's fully available to all families, including families with low incomes. So full refundability eliminates the income requirement, the 15% phase-in, and the refundability cap, and ensures that families with low incomes get the same credit as families with moderate and high incomes, and reaches those 19 million children currently left out of the full CTC. This full refundability was also a huge driver in the child poverty reduction we saw in 2021 and helped millions of families make ends meet. However, as we're saying that the American Rescue Plan Act did not expand eligibility for children with I-10s, it still had that exclusion. So that's what happened in 2021. Alyssa is going to talk about another bipartisan tax bill that is going through Congress that would provide a more modest expansion of the CTC, but this expansion would still help millions of families. And with that, I'm going to stop sharing so that hopefully Alyssa can take over.
Great. Thanks so much, Kat. Yeah, so as was mentioned, we have a tremendous opportunity right now. There is a bipartisan bill before Congress that expands the CTC. And I'm going to walk you through a little bit about kind of what is in that package, what is not in that package, the current state of play, and kind of the political and partisan dynamics that are interacting with this package right now. So the Tax Relief for American Families and Workers Act of 2024 is the name of the package. You might have heard it referred to as the bipartisan tax package, the Wyden-Smith deal. It's had a couple of different names, but this long name is the official title. It's a bipartisan package with a $78 billion price tag. It includes the expansion of the child tax credit, as well as an expansion of some expired parts of the 2017 Republican tax cuts for businesses. It was mainly negotiated by Senator Wyden, the Democrat chair of the Finance Committee, and Representative Smith, the Republican chair of Ways and Means. So as Kat mentioned, there are currently 19 million children excluded from the full credit because of the structure of the CTC and the income requirements involved in it. This tax package, this bipartisan tax package that's currently moving through Congress, would roughly benefit about 16 million children. So that's more than 80% of the 19 million children who are currently excluded from the full credit. So that's a good amount of kids. And in the first year, it's estimated by the Center on Budget and Policy Priorities that it would lift as many as 400,000 children above the poverty line. So most of the benefits will go to low-income families. About 90% of the changes being proposed are aimed at expanding how low-income families can receive the CTC. And middle and higher income families would see little change to their child tax credit. So I'm going to show you a couple of slides to walk through the key changes. I'm just going to share my screen real quick. Hold on one sec. Okay. Give me 1 second. Okay, so there's 3 main ways that this package changes the CTC. It raises the amount low-income families can receive from 1,600 to the full 2,000. And the increase, it's basically done in 3 different steps. So this is one piece that some people argued with about this package. But it gradually goes up for the 3 years that the expansion takes place. And the other piece is the expansion ends in 2025 unless it's extended. So this is not a permanent expansion of the CTC, like, I'll talk about that later. We'll come back to that. But there is parity with the time frame of the business tax cuts, and that's something we fought very hard for. So that is a good part of it. Then this is pretty significant, and you'll see compared to, kind of what Kat was saying under current law. So low-income families would get the full credit for each child. They've changed it to a per-child CTC. So currently, a family with 2 children that earns $12,500 a year gets $1,500 in the child tax credit, regardless of the number of kids that family has. Under this change, that family would get $3,000. It's basically $1,500 per child, the same way that it works for middle income families. And so that rectifies some of the issues that you saw with Kat's examples of, the family groups and how much they were getting. And then the final change is families can use current or prior year income to get a higher tax credit. So this is, you'd hear this referred to as something called the look back provision. And this is particularly very beneficial to parents, moms in particular, who are having to remove themselves from the workforce for a period of time due to pregnancy or caretaking responsibilities. So this is something that was seen during ARPA that got bipartisan support to a certain degree. And this is a way that we are working around, to an extent, the income requirements as part of this package. So for example, a parent lost their job and their income fell under the threshold to qualify. I would add that they lost their job maybe because they had to cut back their hours because of childcare. They can use their prior year's income when filing their taxes. Another example that we give is a mom who has to remove herself from the workforce because she just had a baby and doesn't have any or enough paid family leave, paid maternity leave. She can still, under current law, she would not be able to access the CTC, but with this change, she would be able to use her prior year's earnings in order to apply for the CTC. And this would really help our poorest families get a credit if they currently don't have an income or their income's too low. It's a bit of a way to get around that full refundability issue. So I'm going to stop sharing my slides. Hold on 1 second. I need to get back to my notes. So those are the examples of the changes that the bill does. I just want to quickly touch upon what isn't in this proposal, because it's not everything. It certainly does not go far enough and doesn't include all of the things that we want, but it's a tremendously good start. And it provides something, and if we're able to get it passed, as I'll discuss in a few minutes, it provides something to families this tax season as well. But what's left out of it is basically it's not the full expanded version of the child tax credit that we saw under ARPA. It's not permanent. So this will go away in three years. And some of the pieces you might remember from ARPA that were really popular and talked about a lot from families in the press include the fact that this package doesn't increase the maximum credit amount. There's no young child boost. ARPA had a boost for children under the age of 6. The money still comes in annual lump sum, so there's no monthly payments like we saw during the COVID era. And as I mentioned, it's not fully refundable. So the lowest income families or families with no income or tax liability still don't qualify for this. So let's talk about the current state of play. So the bipartisan package passed overwhelmingly from the House. It passed 357 to 70, which, you know, in this day and age, that's kind of a miracle that anything would pass like that bipartisanly in the House. But now the bill is waiting on the Senate to take action, and we are facing some roadblocks, especially among Republican senators. And some of this dynamic has to do, and we saw some of this a little bit in the House, some of it has to do with, like, you know, hurt feelings. It was negotiated on the Senate side by a Democrat, on the Republican side, by the, you know, on the House side by a Republican. There's a lot of people on both sides of the aisle who felt that they weren't consulted enough, that they weren't in the room. This is like a very, you know, inside the beltway type of toddler mentality, I think sometimes. So some of the issues that we're seeing is that some of the folks just felt like they weren't part of the process, and therefore they didn't feel like their voices were heard. And then some Republicans, they don't seem to have any issue with the business side of the package, but they want to make some changes to the child tax credit side of it. And I can't state this enough. The provisions in this tax bill are the result of intense negotiations, compromise. No one got everything they wanted. We certainly didn't get everything we wanted from the CTC point of view, but it took a lot to even just get it through the House. It had to go through, you know, a markup, and then on the suspension calendar. And there was a lot of pushback on even just getting it to the floor and voted on. So, you know, it kind of went through the ringer on the House side. And now on the Senate side, if any changes are made to the bill at this point, good or bad, it would very likely defeat the bill. There's no chance that if they make an amendment to this package and it goes back to the House, that we would be able to probably pass it again through the House. So what you're hearing right now a lot is that some Republicans want to introduce some harmful amendments. And there's kind of 3 main categories of those amendments that we're hearing about. The first is repealing the look back provision. That's the change to this that I talked about previously, that will allow people to use their previous year's income if they currently are not working in order to access the child tax credit. And there's a lot of bogus claims about the impact of the look back provision on the workforce. This is something that you will hear throughout the CTC debate for the past couple of years, is some Republicans believe that people will stay out of the workforce because of the child tax credit. And I can tell you that I've talked to thousands of moms, and never once has anyone said that the child tax credit is enough to not work. It's not a replacement for a full wages or salary. It comes with 0 benefits. It's not job security. It's just like kind of a very bogus claim. But that's kind of what they are tagging on to the look back provision. And so they want to strip that from the bill. The other 2 amendments that some Republicans are looking to make is expanding the CTC for pregnant people. which would undermine abortion. Senator Daines has indicated that he'd like to expand the child tax credit for pregnant women. And the way that that actually is structured is it's more like a baby bonus, but it includes some really detrimental language in it that would insert personhood language into the national tax code. And so from an abortion ban point of view, that would be detrimental. And then the other piece that is kind of bubbling up is some of this CTC eligibility for immigrant families that Kat discussed. This is another place where there's a lot of misinformation, quite frankly, out there. So, the limitations on eligibility for immigrant families already prevents 1 million children from benefiting the CTC. Some Republicans want to further restrict the CTC for these families by preventing parents with I-10s from claiming their children for the CTC, even if the children are citizens with Social Security numbers. So any of these amendments would be really harmful. Quite honestly, even amendments that would strengthen the CTC could be problematic because any chance of amending the package kind of kills it. But at this point, what we're really looking towards is the Senate is in recess right now. We're trying to figure out how this is going to proceed, and we're going to get floor time. Senator Crapo, who's the ranking member of the Finance Committee, has said that he wants a markup as well. Senator Wyden said there's no way that's not going to happen. So there's a lot of politicking happening right now. But there is some support. We think that there's actually a larger amount of support from Republicans for this package, but only a couple, 2 or 3 have really been public about it, but it has all those business pieces that they really like in it as well. So we think if it makes it to the floor, there's a good chance that this could pass. But we do have a bit of an uphill battle in order to get it to the floor. And we'll discuss in a little bit where you guys come in to try and make that magic happen and ways that you can advocate. But I'm going to turn it over to Patty to talk about the situation in the states.
Great, thanks, Alyssa. I'm going to attempt to share my screen, which is always scary. And hopefully that is working. So I have a lot of slides, but I'm not really going to go through them in detail. And I am happy to send them out later if people want to look at them more carefully. But I'll just summarize and talk about some of the state tax credits. And then I want to wrap up with a reminder of why the child tax credit is such a central issue for infants and toddlers. So state child tax credits are aimed at improving family economic stability the same way the federal tax credit is. And often
I'm sorry, we can't see your screen. I just want to make sure.
Oh, no. Okay, so I'm not seeing.
See the green arrow?
I'm sorry?
Do you see the green arrow? The share screen?
No, it's I've shared, and let me see if I can get out of this. Okay. So I did share. Let's see. Oh, okay. Okay, I know what I did. Okay.
There we go.
Got it. Okay. So okay. So can you see now? Can you?
Yes, we're all good. Thank you.
Okay, great. Okay, so let me get to that back to the let me move you guys out of the way. So you can see the map now that has the state tax credits on it. And in general, state tax credit seems to be aimed more at families with low or moderate incomes, which is different from the much broader targeting of the child tax credit, as you heard. But the other thing that's happened is the negative impact of the COVID-19 pandemic on economic stability for many families, and the success of the expanded federal child tax credit seem to have really contributed to recent legislative trends that suggest states are increasingly looking to child tax credits as a way to address families' needs. So in the 2020 State of Babies Yearbook, only 6 states had a child tax credit, and now 15 states have enacted a child tax credit in addition to the federal credit. So 11 states that are shown in green have a refundable tax credit, and states without refundability are shown in blue. And then we have 3 states shown in gold that don't have child tax credits per se, but have provisions related to the federal child tax credit that helps families a little bit. So I'm certainly not going through this chart, but these are the states with refundable tax credits. And this information comes from the National Council of State Legislatures. So you can go there and find all of the information in detail. But I will note that I was curious about one of the descriptions, and I found that one state where it hadn't been updated. So if you're looking for your state, you may want to go directly to their tax website. But the tax credits differ across all of these states in terms of what children are eligible. A few states limit it to young children. New York, which was the outlier that I was looking at previously, excluded children under age 4, but as of 2023 now includes them. They also differ by family income. And again, it's mostly families with very low income. Maryland is at $6,000, and only families with children with disabilities. The most generous eligibility level seems to be Vermont at $125,000 or less, so much less than the federal tax credit. And 11 states have a fixed limit for the tax credit that ranges from $25 to $1,750, which is per qualifying child. So that's quite a spread of the amount of additional money these tax credits are going to provide. And the provisions of the state non-refundable tax credits, they vary in their generosity as well. And then finally, the states with provisions related to the child tax credit. I think that Alabama should probably be taken off. This was only affected the treatment of the expanded federal child tax credit from ARPA. And North Carolina actually has changed and tinkered with it over time. And right now it allows a higher deduction for each child, but only if they are qualified for the federal tax credit, which, as you heard from Kat and Alyssa, really leaves out a lot of families. The states seem to be continuing to look at creating their own child tax credits. We talk here about Kentucky, Michigan, and West Virginia are called out, and others may be looking as well. So it seems to be really catching on as a way to give parents and families, hopefully some grandparent families, an extra income boost. And then when I send out the slides, you will see the resources that we have. And then the last thing I thought it might be useful to place the states who have some form of child tax credit in the context of how their babies are doing overall. So this is our State of Babies map showing where states fall in our GROW ranking, where G is the lowest and it's shown in the light blue, and W is the highest, shown in the darkest blue. And you can see that in general, states with refundable tax credits are in the higher tiers overall of how their children are doing or their babies are doing. And states with non-refundable credits or with federal CTC related legislation tend to fall in the lower tiers, but it's really important that they are thinking along these lines, that families need some extra economic support. So I want to go now into why it's so important for us as infant toddler advocates to really dive into the CTC. We often see that the baby's defining experience is economic insecurity from high rates of poverty and low income, and those intersect with race and ethnicity. So it really is an issue of equity as well. And this was the first year we looked at deep poverty. So it's really startling to see that a higher percentage of Black and Native American infants and toddlers live in deep poverty than the percentage of all babies living in poverty. So this chart underscores that importance of this extra income for achieving economic equity, but also the need for the full refundability that Kat and Alyssa talked about, since many of the babies in deep poverty likely do not qualify for the child tax credit, or they qualify for very little. And to go a little deeper into the need for the child tax credit and that work issue, that is a key point for a lot of conservative offices, that it's really connected to work. The first graphic is from State of Babies, shows how the majority of babies have at least one parent who works full-time, but they can still be in poverty. And in fact, a third of babies in poverty have at least one parent who works full-time. And for babies and families with low income, which is 200% of poverty, it's almost 53%. But a significant number of babies in poverty also have no parent connected to the workforce, and therefore they're probably among those that are likely excluded from the child tax credit altogether. And while overall it's 6.2%, as you would probably expect, babies in poverty have almost a quarter who have no parent connected to the workforce. And that tells you that they have very few resources. And therefore, the babies that really would benefit from an influx of some level of resources from something like the child tax credit. So it's related to the issue of full refundability. As Alyssa says, it's not on the table at this point, but we will be revisiting the child tax credit in a couple of years, or actually less than that. And this is one of the future considerations that we want to think about. So I wanted to also spend a couple minutes talking about how poverty affects early development, and therefore why the child tax credit is so important to this population, and especially the ARPA version that was so amazing for families. And it's particularly important for us as infant toddler advocates to bring a developmental lens to the debate, because basically the timing of poverty really matters. Because of baby's rapid brain development, material deprivation and family stress has an outsized effect on that development. And poverty literally gets under the skin of babies, and it impacts both their neurological development and their physiological systems. And these impacts can last into adulthood. So we've always had evidence that children in the lowest socioeconomic group are behind more affluent children in measures of language and cognitive measures, as well as emotional development. But with technology, they can actually look into these young brains and see that poverty can actually be associated with diminished brain growth in areas that are important for self-regulation and learning, memory and language, and emotional control. So it works in several ways that poverty brings material hardships and often more chaotic environments. Parents' schedules may be upended because they may have unpredictable work schedules. They may also be under a great deal of stress, and usually are, so relationships may become less predictable and strained, as parents under great economic stress may also be less responsive. And all of these conditions can lead to chronic, unrelenting stress that is often called toxic stress, because it releases stress hormones that really can undermine those neural connections that are developing so rapidly. And so this is what undermines the brain growth in these key areas. So it's really important to understand how key poverty is as a factor threatening early development. A couple other charts from State of Babies that show how much more vulnerable babies and families with low income are to experiences that we know undermine development. So they're much more likely to have adverse early experiences like parental depression, maltreatment, violence in the home or neighborhood, or racism, as well as living in crowded housing and unsafe neighborhoods. And they also, as you would expect, are experience financial strain in terms of the difficulties paying for basic needs. It's much higher for families with infants and toddlers with low income and in poverty. And then again, this chart, and these data come from the Rapid Early Childhood Survey, and they show how over all of 2022 and early 23, the high food insecurity was, as you would expect, much higher for families with low income and in poverty as well. So all of that is to say that families with babies are an important population to reach with a child tax credit, and one of the most important, I would say. And we know that the enhanced child tax credit during ARPA did in fact help many families with infants and toddlers both pay for the basics, used in ways that really enhance their children's well-being, and generally just take the pressure off family budgets. So I think it's equally important to marshal the research that suggests that the child tax credit for young children is a good investment. So I've called out a few here. Baby's First Years is the first causal study to test the connections between poverty reduction and brain development among very young children. And it shows some important indications that it's having a direct impact. And other research shows that relatively modest increases can have long-term impacts on adult earnings and improved health. So that increase, as it turns out, we have a lot of different interventions for poverty, but it turns out that cash actually does help. And another way that it helps is by enabling families to buy diapers, which most other programs for families with low income do not. And so something as simple as that could take a lot of pressure, improve health outcomes, and really help families make ends meet. So with that, I'm going to stop, and I'm not sure who I'm turning it back to. Maybe Brian.
Thank you so much. Oh, get yourself. Thank you so much. Want to now come back to everyone, and I'm going to bring everyone back on. Let's see if I can get this spotlight to work. So we welcome everyone from the panel back up, and we want to talk about action steps and what action steps folks can take to get involved and to support these efforts. And so we can do a round robin or go in order, whoever feels like they have something they'd like to share. I know that each of your organizations are actively working on different components. And so we'll talk about action steps briefly, and then I know we got some questions in the chat that we'll go to, and we'll do Q&A from the audience with that. So whoever wants to maybe go first, feel free to go ahead and jump in.
I could jump in. So Moms Rising has a number of tools that I'm going to provide in the chat. I think the biggest thing that we want to share with you is that we deeply encourage you to take action on the Senate side, basically starting now. They are home for another week and a half of recess, and then they go back. And they have a lot that they need to deal with. They need to pass a budget. There's a whole lot of stuff. We have no idea really where the floor time will end up or the vehicle or how this is going to move through the Senate. But part of what we want to do is make a lot of noise and make sure that we're reaching out to all the Senate offices to make sure they know that we want this to pass. And so I'm dropping into the chat. It's pretty self-explanatory. You're more than welcome to use any of these resources, copy any of these resources and rebrand it as your own. At the very bottom, there's a social media toolkit and resource guide that the Coalition on Human Needs and others have put together. But we encourage petitions, call-ins, letter writing, Hill meetings, and I'm happy to help with any of those pieces as well.
You. I can follow up. I'm going to put a couple of resources also in the chat. Similar, oh, what a fancy little thing they did as my bullet points. I didn't do that myself. So we also have a take action page at the National Women's Law Center, similar to what Alyssa was saying. It's really important to push senators to get this bill to the floor so that families could benefit this tax season, to make sure they pass it, and to make sure they don't do anything to weaken or undermine the bill. Alyssa mentioned some negative things that they could do in order to change it. So that's part of our action page. We also have just a fact sheet that talks about the CTC and other refundable credits, talking about the expansions under ARPA, how it hurt families when they expired. And then we also have, Alyssa mentioned the look back provision and how beneficial that is for families and how we're getting a tax against the look back provision. So I'm including an op-ed on the look back provision in the bipartisan bill about, again, the benefit of the look back and how harmful these attacks are on it. And then also my contact information if anybody has any questions on anything we've discussed today.
Thank you. Patricia?
So my colleagues are going to be hopefully dropping few resources. One is one page on the importance of the child tax credit, or for a fully refundable child tax credit for infants and toddlers, and then also our action alert. And we'll be continuing to go out to our network, and I encourage everybody to alert everybody they know to go to one of the alerts that we have up here in the chat. And just really, I think the key is really bombarding the offices, both Republican offices and some moderate Democrats, and who make it nervous, and really lean in on this is so important. These improvements will make a difference in the lives of so many children. And it's just so important to get this done now. Families have really been hurting. I know that I think our leader from our Family Advocacy Network is on the webinar today. And I know that we have been hearing from families what an amazing experience it was to have the child tax credit, to enable them to spend more time with their kids. To really, one of them had gotten her car repaired, and she said, there are no warning lights on the dashboard now, and that's just amazing. And I just felt like that was just a metaphor for what families felt. So just important to make our voices heard, that this is really about children. It's not right now it is the working parents tax credit, but it really should, if you want it to be about children and really impact children, then some of the young children, especially but all children of all ages, are going to benefit from these changes. And so just everybody's voice needs to be heard.
Thank you all so much for that. Really great action steps. And I'd like to also add that the NCIT has launched an action alert where you can contact your senator. Just takes about 2 minutes as well. And Allison Frazier posted that in the chat. And I'm going to post it again for those who may have missed it. So you can feel free to take the time, share it with friends and family, get folks to share any one of these action alerts from any organization. We want to make sure that we're putting pressure on our elected officials to pass policies that positively impact outcomes for our children and for young families. And so it's exciting to do that. I want to now also, we have a few questions in the chat that we'll go to, and then I want folks in the audience to use the raise your hand function, and we'll kind of go down the line to see if others have questions that our panelists can answer. But we'll start with this question from the chat from Sharon Stoltz. It says, will retired grandparents raising their grandchildren still be excluded? Meaning they cannot apply for a Social Security income towards the credit.
Yes, unfortunately, the income requirement that the grandparent was an example for, that earned income 2,500 is still existing even under this bipartisan tax plan, which is why we sort of think of this tax deal as one step towards greater changes that would help more people. And Social Security income does not count as earned income for that 2,500 requirement.
Okay. Thank you so much for that. Is there anyone in the audience who has any questions that they would like to ask in these last few minutes? Please use the raise your hand function. You can raise your hand and we'll acknowledge people in the order that we see them called, or you can feel free to pop your question in the chat if you have one. Don't see hands going up. That may be a good thing. That means that you guys really gave folks a good bit of information and laid it out. And so what we're going to do now is you'll see poll questions that are popping up for you all to answer. And so if you could take just a few moments and answer these poll questions as we close out of today's workshop, that will be very helpful for us. And so once we get kind of critical mass of folks responding to the poll, we'll continue to move on. So you'll see the poll questions pop up right in front of you on the screen. You can take a moment to answer those questions. It's kind of our way of post-workshop survey. So that way we don't have to chase you down to get the answers to how you felt about today's workshop.
And Judge, there's also a question in the chat about how the federal tax credit, I think, interacts with the state income tax.
Oh, I missed that one. Did you
I will
want
look
to
to
take
Kat since she's the tax expert.
So the federal tax credit is applied against federal taxes. I believe state tax credit is applied against state taxes. I'm seeing Alyssa's nodding. Okay. Because I know that we do some tracking on state tax credits, a different type of refundable tax credit, and states without income tax don't have those credits. So I believe that's the case, though I'm more of an expert on the federal side.
Thank you so much for that, and thank you for that question, Holly. We appreciate it. And we're about halfway there, folks who completed the survey. So we'll leave it up for a few more moments. And Andrea, are you controlling the survey? Maybe we can go to the next question. It's just 3 questions. So much to our panelists. We know that this is really a hot topic with all the changes that are happening right now, and helping to make sure that families understand how these child tax credits work. And we also know that like these workshops that we do and offer to you as the NCIT, this work comes out of real live requests from advocates on the ground in our networks who are asking for help on different issue areas. And so this is one that came up, and we wanted to make sure we got this resource to you. To make sure that folks understand exactly what's at stake and what they can do to engage. And so as you answer those poll questions in closing, I'd like to say again, thank you all so much for listening. Your passion, work, and advocacy on the ground is what keeps us moving at the NCIT, and we are here to support you. And so if you have requests for technical assistance or need support, we are a resource. Please do use us as a resource. If you have workshops or trainings or need a support for that, please do send it to us. We are here to help develop those trainings and do outreach on specific issue areas. Please utilize us here at the NCIT to support the work that you are doing on the ground so that we can amplify it and make sure that the information and resources gets in the hands of those who are most in need. So again, thank you all so much for joining us this afternoon, and we'll close out now as you all complete your poll questions. Thank you all.